Hi, everyone. Welcome to the ICA's monthly speaker series, Navigating IC-BPS Conversations with Experts. We are delighted that you are here with us today to learn from Claudia King, ICA Board Vice Chair, and Amber Carter, ICA Board Member. Please note that this session will be recorded. If you are on camera, your video will be included in the recording. We will have a Q&A session following the presentation. To ask a general question related to the topics throughout the session, please use the chat feature. Once the Q&A session has started, you may also use the raise hand feature in Zoom. You will be asked to unmute yourself. If you aren't speaking, please be sure to stay muted. Claudia and Amber will answer as many questions as they can during the webinar. And finally, please complete the post-webinar survey. A link to the survey has been posted in the chat. It's time to get started. So without further ado, please welcome Claudia and Amber.
Good afternoon. I hope everybody is having a wonderful, wonderful day. We're going to get our slides pulled up here in just a moment. I'm just waiting for the screen sharing to become available. While we're waiting on that, I do just want to say, while Amber and I do consider ourselves experts when it comes to IC, we are not medical experts. So please, always consult your physician before you decide to do any treatment, before you embark on any new medication, anything like that at all. So just always keep that in mind. So as Jenlene mentioned, Amber and I will be leading you through this presentation today. So I am the Board of Directors Vice Chair, and Amber is a member of the Board of Directors. We are both IC patients and have been for quite some time. I'm also a podcast host, and Amber leads our MAC Liaison Committee. So we have a Medical Advisory Council, and she actually works with those healthcare providers to help us with the ICA. And then we also are both advocates for IC and speakers, and Amber does a great job with volunteer events as well. So what we want to talk about today is healthcare and how you can effectively navigate the healthcare system. And this doesn't just apply to IC. It would apply, really to any chronic illness or just in general, if you want to take control of your healthcare. A lot of times when we're diagnosed with a chronic illness, we feel like we've lost control. We feel like somebody else is in power. And we want to do everything that we can to give you a little bit of that power and control back when it comes to your healthcare. So we're going to talk about how you can navigate that system a little bit better. We're also going to talk about self-advocacy. So basically how you can approach your healthcare team and effectively communicate with them so that you can get the care that you need. And then we're also going to talk a little bit about insurance issues, including care and coverage. So whether you have insurance or not, we're going to walk you through a couple things that will hopefully make navigating medical care a little less stressful for you. And if you don't have insurance, we're going to give a few tips on things that you can do that will help you out with that. So our plan today, we're going to first talk about why you should form a care team and what that means. We're then going to talk about advocating for yourself with your doctors and medical professionals. We're going to talk a little bit about insurance coverage and denials. We're then going to open it up for questions. So please, if you have any questions throughout the presentation, feel free to pop them in the chat, or you can wait until the end to ask them out loud. And then we'll do a quick recap and talk about a few next steps.
Hey everyone, I am Amber Carter. I've been on the board now for about 2 years, and I'm so excited that you guys are here. I think this is such an important topic for us to talk about. The first thing that we kind of want to address is that, yes, we have IC, but it really is an entire body issue. So the bladder and then everything else that kind of comes with it all kind of works together. So we kind of want to talk about what type of physicians that you want to approach with this issue and what their roles are going to be. The first thing and the first step that you all have probably attempted is going to your primary care doctor. Now, primary care doctors really have a great understanding of the entire body, but they do not do any type of specialization. So while they may say, okay, you have IC and these are the medications that we can prescribe to you, whether it be pain medications or overactive bladder medications, they really aren't the specialists that you need when it comes to IC. A urologist is really going to be the best person that you can go to when it comes to treating IC. Typically, they will have a good understanding of IC and a good understanding of the urinary system. But because as women, a lot of these things with our female issues as well as our bladder issues kind of go hand in hand. So having a good gynecologist as well is extremely important. Now, there is a new kind of specialty that has arisen out of the last couple of years, which is a urogynecologist. And that's someone that we can go to that specializes in not only the urinary system, but also the gynecological system and how they work together. If there's any males that are attempting this, you probably want to go the route of going to the urologist. Females, I would suggest having a wonderful urologist and a wonderful gynecologist, or going to a urogynecologist that specializes in both. As we know, as IC patients, there are so many different things that contribute to us having IC. Maybe we have IC, but we also have other conditions as well. So maybe we have things like pelvic floor dysfunction. Maybe we have things like diet sensitivities. Maybe we have things like other autoimmune disorders such as lupus, Sjogren's, rheumatoid arthritis. All of these encompass all of the things that a lot of people have with interstitial cystitis. A lot of times it's not only interstitial cystitis. So I absolutely would suggest going to someone like a urologist and a gynecologist or a potential urogynecologist, as well as a physical therapist. There's a lot of talk around things like physical therapy for pelvic floor dysfunction. And one thing that I kind of would love to clear up is that interstitial cystitis and pelvic floor dysfunction are two very separate things. So one can cause the other or vice versa. And it's very important that when you're going to your providers, that they understand that physical therapist is treating the pelvic floor muscles. And those in turn, which encompass the bladder, will assist with kind of treating those things like urgency, those things like spasming, those things like relaxing the pelvic floor muscles. They specialize in that. And that's something that I absolutely would recommend to any interstitial cystitis patient, whether you have any kind of bladder-centric interstitial cystitis, or maybe you have a pelvic floor centered interstitial cystitis. Of course, when we go to the urologist and our primary care and our gynecologist, the first thing that they're going to say is that, oh, here's a pamphlet. These are the things that you need to abide by when it comes to diet and interstitial cystitis. And now that we've learned over many years of research and different phenotyping, some people are very, very sensitive when it comes to diet, and they know kind of the things that they need to avoid in order to avoid a flare. Some people are not diet sensitive at all, and it may be other things that are causing their symptoms, such as stress. But a registered dietitian absolutely can help you go through the things that you're eating and go through an actual program of determining what things that you can possibly tolerate and what things that you don't. So all of these things are encompassing when it comes to the whole body treatment of interstitial cystitis. Also, I'm sorry, the other thing that I forgot too is the endocrinologist, because there are some theories that hormones can affect interstitial cystitis as well. So if you're having those symptoms, it's definitely worth it to go to a endocrinologist, or if your gynecologist is willing to work up that kind of blood work to see where your hormones are, just to make sure that everything is within the normal limits, that can be helpful as well.
So as Amber mentioned earlier, there are a lot of things that can contribute to your IC, or a lot of symptoms that can be caused by IC that might be outside of your bladder. Additionally, I know I have a lot of coexisting conditions or comorbidity conditions that I'm just lucky enough that because I have IC, I have a bunch of these other things as well. And so we want to talk about some of the additional options that you can consider adding to your care team. So first off, mental health professionals. My very first urologist, I said to him one day that I was depressed, and he looked at me and said, "You have IC. I would be surprised if you weren't depressed." And that is true for a lot of us. So our mental health is just as important, and sometimes more important than our physical health. So it's always great to have that mental health professional that you can go to, and whether that is to do talk therapy or some other type of therapy, or to coordinate with your primary or your urologist to prescribe medications. Pain doctor is another one that you may be familiar with or are becoming familiar with. So not too many years ago, one doctor could really prescribe everything. And I know for me, my urologist prescribed everything from my hormones to my narcotic pain medication. And because of the opioid crisis, that has really changed. And the medical profession has really segregated out pain control and pain care. So there are now pain doctors, and they solely focus on dealing with your pain, whatever that cause is. So generally you do have to have a referral to that pain doctor, but they will really look at everything that is going on and that could be causing your pain. They'll look at the other medications that you're on, and they'll work with you to create a plan that will hopefully reduce your pain. And I say reduce because I think a lot of us sometimes want to have zero pain, and we deserve zero pain. But unfortunately, that's just not reasonable quite often when you're dealing with IC or other chronic health conditions. So we really have to figure out what level of pain is livable, and then that's what we want to make our goal. And your pain doctor will work with you to get to that goal. Another type of pain doctor is an injection doctor. And a lot of times I'll hear people, confuse these. So they'll say pain doctor, but they're referring to the spinal pain doctor. But again, it could be a condition that you have in conjunction with your IC. So the injection pain doctor is someone who's going to do things like epidural injections, nerve blocks, nerve ablations, things like that that are more related to your spinal cord and other types of injuries or issues, but could be a good member of your care team if you have an issue like that, because it's just going to contribute to your pain level. An allergist is another great one. I know I suffer from what seems like constant allergies. I've decided I'm clearly allergic to air because no matter what the season, I'm sniffling or sneezing or something. I also know that some doctors do think that there is an allergic component to IC, and they think that some allergy medication can help IC. So an allergist is a great one to loop into your team. Neurologists and neurosurgeons, again, it could be another condition such as migraines or other injuries or chronic conditions that could be contributing to your overall health issues, and you need to separate that care. Lastly, a rheumatologist is another great option. Again, I know I've said it a million times, but so many of us deal with so many different medical conditions. And when we think about why we need all these people, and everybody doesn't need every single one of them, but think about it as, if you're a sports fan, think about it as your football team. Or if you like music, think about it as your band. So, your quarterback isn't going to be great at catching the ball or getting the tackles out of the way. That's why you need those other players or those other positions to do that. So with this whole care team, you're creating your entire sports team or your entire band, so that all of you can be cared for in conjunction with everything that's going on. So why do you need a care team? We've already told you the 87 doctors that you need potentially on this team. Why do you need them? So one of the most important reasons is for a comprehensive treatment plan. So you need people that truly understand everything that is going on with you so that they can collaborate and decide on the best treatment plan for your different conditions. You don't want somebody that maybe doesn't know about your IC to prescribe a medication that then is going to make your bladder worse, or they prescribe a bladder medication that then makes you feel more depressed or more tired. So having this entire team that can create a comprehensive plan for you is going to result in better long-term care. It will also serve to have improved communication and coordination among your healthcare providers. So it's going to give them all the information that they need, and often they will communicate directly with one another with your permission to figure out the best treatments for you, taking into account everything that's going on. And what I think are really the most important reasons to have a care team is about you. So it's about better outcomes for you and a better quality of life. We deal with enough problems when it comes to IC that we really need to do everything we can to tip the scales in our favor. And by having that care team and including the different providers that are right for you and that are relevant for you, depending on what issues that you're dealing with, can result in a much better outcome for you, a way better quality of life, less pain, and a happier and healthier life going forward.
So let's talk about building your care team. And this is a very, very important issue. The first thing that I want to talk about is, obviously, wherever you live, whether it be in the United States or a country abroad, you need to just go ahead and Google specialists that are in your area. When it comes to interstitial cystitis, I will say that unfortunately, there are very few providers that truly specialize in interstitial cystitis. So it possibly may require you to travel a couple of hours to find somebody that truly understands interstitial cystitis. Personally, I live in Florida, and my urologist that specializes in IC is in Texas. So I unfortunately have to travel in between the states, but that is just something that I have to do. Now, the first step should be asking your primary care doctor, who do you recommend for interstitial cystitis? Um, my experience has been that they will give you information, numbers, contact information for urologists that are wonderful. We can't even come up with anything negative to say about them, but unfortunately, they may or may not specialize in interstitial cystitis. If they do, you are extremely lucky. Unfortunately, the majority of them do not. So if that is the case, I would suggest that you just start Googling, you start researching and finding somebody that is closest in proximity to where you live. The other great thing is social media nowadays is we can ask other patients, who do you go to? Who have you had a wonderful experience with when it comes to a urologist or a gynecologist or even a urogynecologist that treats interstitial cystitis? Patient referrals are invaluable. They can tell you, hey, I had a wonderful experience with this doctor, or I had a terrible experience with this doctor. And then from there, you can work to build your care team. One of the things I do want to mention is how important it is to have your entire care team working together. So if you have a urologist, a gynecologist, a urogynecologist, physical therapists, they should all be working together and reviewing your patient notes in order to help treat you as a whole.
I do want to add on one quick thing that Amber mentioned. It's okay to date your doctors. And I don't mean what you're thinking right now, that you're going to go out to dinner with them after your appointment. But what I mean is it's okay to go see somebody. And if you don't like them, go to the next one. Yes, sometimes we do have restrictions when it comes to our insurance or when it comes to our location and the proximity of physicians, but avoid at all costs going to somebody that you're not comfortable with or that doesn't have the characteristics that are important to you. And what I mean by that is me, for example, bedside manner is really important to me. I want my doctors to walk in and act like they care about me and I'm the most important person they've seen that day. The minute they walk out of the room, they can roll their eyes and say mean things about me. But while they're in there, I want to at least think that they care. So that's one of the things that I look for in a provider is that bedside manner. Now, for some people, that might not matter to you. So think about what characteristics are important to you, just like you would for a friend or a significant other, and put those down in a list and look for those in your different care providers. Okay, so we've now assembled our team. We have all of our amazing healthcare providers. We've got them communicating with each other. Now we're going to our appointments. So now what do we do? Preparing for your appointments can be even more important than the appointment itself. So some of the things that you want to do before your appointment, you want to keep a symptom diary. And why that's important is because you need to have an objective scale to provide to your doctor about how you're feeling and the symptoms that you're experiencing. Particularly when you are newer as a patient, then this doctor doesn't really have a reference for you. They don't know you yet. So they don't know if you have a really high pain tolerance or a really low pain tolerance or, what specific triggers that you have. So if you can walk in there with that symptom diary and be able to say, hey, Dr. X, the last 7 of 10 days, my pain level has been at a 6. I would really like to get my pain level to a 3. I feel like that is a place where I can live and be comfortable. Let's work on doing that. They're going to be blown away because first off, the pain scale. So that's going to, make them very happy because that's kind of universal. But they're also going to be really happy because they can see that you take an active role in your care and the management of your health and your illnesses. So make sure when you have that diary to note dates, times, any triggers, whether that might be food or environmental, maybe taking a car trip, whatever it may be that seems to have made your symptoms worse or even made them better. Make sure to note those things. And, I like to use my phone, the notes app. So whether it's that or you're a good old pen and paper kind of person, start doing that regularly and make sure you take that to every single appointment. The next thing you want to have before your appointment are your questions and concerns. So I know that most of us want to walk in there and we want to have every single question answered. We want to be cured of everything that we're dealing with and leave, 100% better. Unfortunately, we know that's not generally the case, and we do know that doctors are busy. Now, yes, they should spend the appropriate amount of time with you answering all of your questions and making sure that you're comfortable with the treatment plan. But it's also great if you have a couple specific questions or concerns to go in with. Write those down so that you can begin with, here's my symptoms. Here's the things that I would really like to accomplish while I'm here with you today. Again, this will wow them because you are showing that you are mindful of their time, and then they can be mindful of your time as well. I also like to have an advocate with me. And what I mean by that is a trusted family member or friend that can accompany you to your appointments. So generally speaking, my husband is my advocate, but I also have a friend who's a physical therapist. And so for certain appointments, she will go with me because she knows different questions to ask than I might ask. Some of the things that you want to see in your advocate is somebody that isn't afraid to speak up. So if there's something that you forgot to mention or something that they know maybe you're a little hesitant to bring up, they're going to be that voice that will step in and say, we need to ask about this. Hey, remember, we need to figure this out. So you want your advocate to be comfortable doing that. You also want your advocate to be able to listen and or keep notes. Sometimes when we're the patient, we get very overwhelmed. Maybe we hear a diagnosis or a treatment plan that suddenly we're very uncomfortable with or we're not sure about, and our brains shut off. And we leave that appointment and we don't remember anything that they said after whatever it was that made us uncomfortable. So it's really important that your advocate can be there to really listen, take notes, and make sure that both of you walk out of there with all the information that you need. So, performance anxiety. We all get it in one way or another. And this is our doctor appointment performance anxiety. So we can get very anxious, especially when we're seeing a new doctor because they don't know us. Are they going to think I'm making this up? Are they going to think I'm crazy? So we get a little nervous. So just remember to stay calm and always be respectful. Respect goes a long way. And I do believe in, giving respect and getting respect. But at the end of the day, remember, that can be your last date with this person. So if you walk out saying thank you and being respectful, then you're going to be good to move on to the next one if necessary. Again, you want to have your top 2 concerns. So what are the things that you really want to make sure get accomplished in that visit? You can have more than 2, but 2 is a pretty good number to be able to address during that appointment. You also want to talk to your advocate ahead of time and tell them what is their green light. So when do you want or need them to step in and start speaking with or for you? So it could be a code word, it could be a look, whatever you feel comfortable, but decide, when this happens, I'm signaling to you that I need you to step in and start communicating for me and advocating for me in that moment. Couple things that you want to remember when you're leaving your appointment. So make sure that you update your medications. And I mean that for yourself. So I, again, in my notes app, have a list of all my medications that I'm taking because there's a lot of them. So make sure if the doctor has changed any medications, the dosage, or added or taken away medications, make sure to update that in your record that you carry with you. Make sure that you get your next appointment scheduled. I know I'm very guilty a lot of times of saying, oh, I'll call and schedule it later. And I hate making phone calls, so then I never do it. Also, a lot of these doctors that we're seeing are very, very busy. And if they are specialists, especially with IC, they are booked very far out. So the earliest that you can go ahead and lock in that appointment, do it. You also want to have your advocate review. So now you're going to grade your advocate on how they did. You're going to talk about, what they did well, what maybe they could have done better. Hey, remember our code word. I really wish you could have spoken up here because, I was just really flustered. Remember to praise them because they are going out of their way to help you, but it's okay to tell them what you need from them. And for them, vice versa, to tell you, hey, you were going to mention this and you didn't. It's important that you manage your health care and that you're the driver in this situation. I'm going to keep talking now. So
And if unfortunately you don't have someone that can go with you to the doctor's office, one thing that I would suggest is to record on your phone the actual appointment. Sometimes, like Claudia said, when we're in the appointment, maybe we hear one thing and we process it, or we hear one thing and we stop hearing after that. But if you let the doctor know, hey, I'm going to record this conversation and this appointment on my phone verbally so that I can refer back to it later, then that will give you a little bit more confidence to know that you can refer back to what the doctor said and see if maybe what you heard in your mind was exactly what they said. When you're communicating with your provider, the one thing that you really want to think about is just being honest. And you need to be honest with your symptoms and what their impacts are on your life. A lot of these things that we're discussing with our providers, unfortunately, are embarrassing things that many of us don't want to talk about. We don't want to talk about it with our spouses. We don't want to talk about it with our friends. We don't want to talk about it with our family members, but we should be comfortable speaking about it with our providers. Because if they do not know exactly what's going on with how it's affecting your life, then they cannot help you. So when you're expressing these things to your provider, absolutely use things with a quote, I as the preface. So I am experiencing urinary urgency. I am experiencing pain. I am experiencing urinary frequency. I am experiencing pain when it comes to my sexuality. These are the things that the doctors need to understand that are directly impacting your quality of life. And that's the main reason that you're there. There is absolutely nothing to be embarrassed about. Um, these are things that the doctors hear all of the time, and they cannot help you unless they properly understand exactly what you're going through. A lot of times when we go to these providers, they tell us things and they give us pamphlets, and maybe we live there and we're thinking, I don't completely understand what they're saying. Before you leave that room with the provider, make sure that you have any concerns that you can think of in that moment for them to clarify. So if you don't understand, ask them. You need to be assertive, but not aggressive about it. If something seems a little bit strange with the encounter, a lot of us with IC have been to providers that it's clear that they don't understand interstitial cystitis, or they say things that maybe you think in your head doesn't seem quite right. Always get another. And one thing that I have noticed is that it's very important for a provider to be comfortable with you getting a second opinion. I have gone through situations where I've been to multiple physicians and I have had multiple different diagnoses. So in that situation, there have been providers where I've said, hey, I think I'm going to go check out someone else, see what they say. If they give you a hard time about it, that's not the right provider. A good provider will tell you, absolutely, go see someone else, see what they say. I want you to feel comfortable. So the importance is just being respectful to your current provider and fact-based with all of the information that you're giving them and all of the information that they're giving you. And if you're not comfortable with it, go see somebody else and see what their opinion is. You can always revisit exactly who you want to go to in order to treat your interstitial cystitis. There is no embarrassment. So we all know when we're going to the gynecologist or if we're going to the urologist, okay, it's going to be a little bit awkward. I mean, we can't kind of fluff around that situation. But there are things that can make it more comfortable. You want to make sure that anything that you're doing, that you're completely comfortable with. So if you're at the physician's office and they ask you to do something that you're not comfortable with, don't do it. There's a lot of physicians and urologists, gynecologists that would like to do things like get a urine sample by cathing you in the office. If you're not comfortable with it, absolutely don't do it. If you feel like it's going to cause you pain or any type of trauma, don't do it. There's other treatments for interstitial cystitis, things like a cystoscopy or Botox injections or instillation. And if you feel like that's going to cause you too much pain, or if it's going to cause you trauma, or if you're not completely comfortable with doing it, absolutely do not do it. This is your body, this is your empowerment, and you need to do what you're comfortable with doing.
I totally agree. And remember that it's okay to take some time as well. So if they're proposing a treatment and you're just not sure, it's okay to wait. You can say, wow, I wasn't expecting this. This is a lot for me to digest. I just need to think about this and make sure that this is the right decision for me. So that's totally okay. And like Amber said, if any physician takes offense to that, then that's probably a red flag that they're not the right person for you. So we're going to talk a little bit about insurance because it has become a 4-letter word for a lot of us. I know some of us don't have insurance. Some of us have very poor insurance. And then some of us, even with good insurance, still struggle in getting insurance to cover things. So first and foremost, understand your plan. So most plans have in-network and out-of-network. They have preferred providers. They have, different treatments that they want you to do before others. So it's really important that you understand all of those restrictions. So if you're like me right now, Blue Cross Anthem is fighting with some different healthcare providers and have stopped coverage. So it was important for me to understand that and know which physicians fell under that umbrella of coverage that I can't see right now, or that I'm going to have to pay out of pocket. So understand, what deductibles that you have, what your copays are. And if all of these words that I'm saying right now are foreign to you, then you want to understand those as well. So you want to understand what your copayment is. You want to know what deductible or out-of-pocket maximum means, because a lot of times if you are having a surgery or some other type of procedure, you might meet your out-of-pocket max for the year. And so sometimes you want to schedule things, obviously always medically necessary, but your timing may be affected if your insurance is going to reset at a certain date or something like that. Denials are something that we've probably all experienced. And sometimes you don't even know that you've experienced a denial, because your healthcare provider will actually submit to your insurance ahead of time for a pre-approval, and it will get denied. Unfortunately, a lot of our insurance companies have doctors sitting, I don't know where, at a desk somewhere, and those doctors are making the decisions on what treatment is appropriate for us. Now, you might have a pediatrician deciding what interstitial cystitis treatments are right for you. That is very aggravating and very unfortunate. But what we need to do is just understand that and understand how to work with that. So this goes back to understanding your insurance. Most of the time, if you receive a denial, you can appeal that. So you have a certain period of time that you or your doctor or both can contact the insurance company and explain why you believe that something should be covered. Now, saying because I want it won't necessarily get you an approval. You need to, again, be assertive, fact-based, and clearly spell out for your insurance company why this is the right treatment for you, why your physician has decided this is the right treatment for you. And again, your doctor will often do this, but if you do it as well, then you're more likely to get that approval and more likely to get it more quickly. So I would encourage, if you're not comfortable writing, find somebody in your friend group or your network that is, and have them help you craft this letter if you're going to try to get a denial overturned and you're going to appeal that. It goes back to I statements, like Amber said earlier, and it goes back to really explaining your current situation, how you are being affected, and how that treatment could change your health care and your status as it relates to your health. I'm going to give you guys a secret today that I've literally never given out before. So consider yourselves lucky. Social media is a great place to reach out to your insurance companies. Everybody has an account on X. And when I say everybody, I mean your insurance, car rental companies, hotels, all of these places. And most of them have dedicated individuals that only monitor social media and respond to people who complain on social media. So my X account is only full of complaints because I literally use it just when I need to reach, whether it's my prescription company, my insurance company, Hertz rental car, whoever I need to reach out to try to get a really quick response. often using social media is the way to do it. Again, be respectful. Try not to use your 4-letter words in your post, but just say, wow, I'm really having trouble with this. Tag them. That's the most important part. Make sure that you tag them on their official account. And quite often, within an hour, but usually within the day, you'll receive a message back from them telling you to reach out via an email or direct message, and they will then escalate your response. So me personally, I had a medication that I needed approved, and I literally needed it that day. I mean, and it was going to be a long weekend. There was a holiday on Monday. So I was going to be in a really bad place if I did not get this approved. We had called, we had emailed, we had done everything. And my last resort was posting on X. They immediately reached out to me. Brittany, I still remember her name, got that medicine approved for me within a matter of hours. And had I not gone to social media, I probably still wouldn't have the medication. So use your socials, but use them wisely. So as I said earlier, a lot of times, we don't have insurance or we don't have enough insurance, and that can be a really difficult thing to navigate. So while I wish that we could all just win the lottery and not have to worry about medical costs, that is not an option. So some of the things that you can do, prescriptions, there are companies like GoodRx. They are free to you, but they provide you discount codes for prescriptions. You can often go to their website. You can put in the exact medication and the dosage, and it will give you a list of all the different pharmacies in your area and what the different costs would be at each pharmacy. Then you just go to the one that you've chosen that has the best price, and you give them like a group code and the information on your new GoodRx card that you're going to print out, and they will process that for you. So that's a great one for prescriptions. And sometimes even with your insurance, prescriptions are really expensive. Check GoodRx and any similar company to see if they might have a better price. Never pay for that though. So if you see a prescription company separate from your insurance that wants you to pay, I would avoid those. So go to the ones that are free online. You can always ask for a discount. So I know that might feel weird, but for me, when it comes to money, I want to save every dollar of it. So you can always ask, and all they can do is say no, right? And then you're in no worse position. But if you are a cash pay, so if you don't have insurance, make it clear to that provider, hey, I don't have insurance. Do you have a cash pay discount? And often they will have a 50% or greater discount when you do pay cash. A lot of times you can set up a flex card or a health spending account. So often those are through employers. So if you or your spouse has those available, I would recommend doing them. I'm not a tax professional, but those monies go onto that card pre-tax. So you do save a little bit of money throughout the year if you bank the money on your flex card and then spend that through the year. There's also cost sharing programs. So I'm not super familiar with them, but it's basically like a group of people, almost like a little community says, we're going to share each other's costs. And you pay a certain amount every month. And then when one of you has something that needs to be paid, you submit that to this cost sharing, and then they pay it for you. So we can't solve all of your insurance issues, but we want to give you a couple ideas so that you can at least work on what you can so that you can get the treatment that you absolutely need. There are also some really creative ways that you can get to cover certain things, and Amber's going to talk a little bit about that.
So when it comes to submitting things to insurance, as we all know, insurance loves to deny claims. That's what they do. That's what their game is. So when it comes to interstitial cystitis, because our condition encompasses so many different things, it encompasses urinary retention, urinary frequency, urinary urgency, urinary spasms, pelvic floor dysfunction. There's so many different things and so many different medications that each patient may potentially need. And one thing that I just want to touch on, and this is me personally, I've been doing Botox for my interstitial cystitis for about 15, 17 years. I don't know, it's been so long, I can't even keep track anymore. But while the Botox is not, quote, FDA approved for interstitial cystitis, it is FDA approved for things like overactive bladder and urinary frequency. So those are the things that your doctor can piggyback on. For instance, had my doctor gone ahead and submitted it to my insurance for interstitial cystitis, it would have immediately gotten denied, of which it did. So they proceeded to fight it harder and said, well, we're doing this because of the frequency and the urgency and the overactive bladder. At that point, it ended up getting approved. So these are things that your doctor should be willing to do to fight for you. So, you know, when I hear these articles and when I hear people talk about, oh, it's not, quote, FDA approved, well, not necessarily, but because IC encompasses so many other issues like all of these other things, it should be approved by the insurance to treat these other things. So that's something that you can talk about with your provider. They should be willing to fight your insurance company for you. Again, if they're not willing to fight things like that, then it's likely a red flag. There's also a lot of medications that are used for interstitial cystitis that are sort of off-label, like Flomax, which is a medication that's known for treating prostate issues. A lot of IC patients are prescribed this medication so that they can have easier urination and less spasms. Other things like muscle relaxers, like Flexeril, that maybe are not initially thought about for things like interstitial cystitis and pelvic floor spasms. A lot of these medications go hand in hand with interstitial cystitis. So if you initially get a denial of any kind of medication, or if you go through a procedure that has something like the Botox or any kind of installation, these are things that you can fight with your insurance company, as long as your provider is willing to do that. As long as your provider is willing to say, hey, these other things didn't work. This is what seems to be working for my patient. And one of the most important things that you guys just really need to always remember is that this is your body, this is your life, this is your fight. And your provider should be right there with you, hand in hand, fighting this with you, with your insurance company.
We have gone through what felt like a lot, so we would love to open it up for questions for a couple minutes. I see there's some stuff in the chat, but I can't see the chat. So I'm going to lean on Jen Lean to help us out with that. So if you have questions, throw it in the chat or raise your little virtual hand.
Thanks so much, Claudia and Amber. Yes, we have some comments. One comment is, that's such a good point about saying no to treatment suggestions. I just agreed to a bladder wash installation against my better judgment, and it made my symptoms incredibly worse. I know my body and know that it is sensitive to any disruption, but the nurse convinced me that it works for so many people. I should have listened to my gut. I have had several cystoscopy procedures that have put me in remission for 2 years at a time, but now that I'm in menopause, nothing seems to be working. And then they write, and it's so hard for husbands to understand the pain. So bringing my husband along to doctor appointments is a great suggestion.
I know that wasn't necessarily a question, but I do want to say thank you for whoever shared that. I'm so sorry that you had that unfortunate experience. And yes, so going forward, like you said, you know your body better than anybody. And yes, you're going to the doctors to treat you, but if something doesn't sound right, it's okay to hit pause and take a minute to make sure you're making the best decision for yourself.
One thing I'd like to piggyback on for that is that when it comes to things like hydrodissensions and cystoscopies, can they be done in office? Yes. Can you ask for them to be done under anesthesia? Yes. So if you're uncomfortable with it being done in office, absolutely ask for it to be done under, heavy sedation or full on general anesthesia.
We have another comment. It says, I'm afraid of Botox because I hear it can cause urinary retention to the point I might have to strain to urinate.
Okay, I'll take that one. So I've been doing Botox for a long time now, every 3 to 4 months. What I will say is that when it comes to the Botox, it's very important that the provider that's doing the Botox understands how the bladder, the urethra, and the pelvic floor work. So some IC patients are completely bladder centric, where maybe they only need injections into the bladder to help with spasms. The majority of the IC patients are bladder centric plus pelvic floor centric. So, for instance, myself, I get the injections in the bladder as well as the pelvic floor and the urethra. A lot of physicians do not do it this way because of their concern with things like retention. The best advice that I can offer you for this is to start out very slow. You can start out at something, I think the minimum for the Botox is maybe around 50 cc's, and then the maximum is around 400 cc's. So you can start out very slowly and make sure that they're dispersing the injections around the bladder, around the pelvic floor. And then as long as you don't have any retention with that, then you can increase it 25 or 50 cc's the next time in order to avoid the retention issue.
Amber, is it correct that because Botox does wear off in time, that if for some reason it did cause an unwanted reaction, that theoretically that reaction would fade in a few months?
Absolutely. So just like we inject Botox into our face and our forehead so that we look beautiful and plastic to the rest of the world, it will eventually wear off. And that would typically Botox takes effect within 10 to 14 days from the injection, and then it will wear off anywhere from 3 to 5 months after the injection. So if, God forbid, there was some kind of retention, that would wear off. It is not permanent.
Thanks, Amber. It looks like we have Judy with her hand up. So Judy, if you'd like to ask your question.
Yes, it's not really a question. Well, it could be a question. I don't know. Comment.
Or comment.
I'm doing much better right now, but I was saying from around September 2023, well, maybe it's more like August 2023 until November 2023, I was absolutely miserable. And I was running from one urologist to another, and I consulted pain doctors. And I guess I feel a little nervous now talking on this public forum, so it's hard for me to ask my question. The only thing that works for me is an opioid medication. And I take it very carefully because I don't want to get, I don't want to get, what's the word I'm looking, it's not addiction I'm looking for. I don't want to build tolerance because it's important for me to have a medication that's going to work. And if you take too much of it, it's not in my interest because I need it to work for pain. And my experience with consulting with a couple of pain doctors is that they were pushing this DRG spinal cord stimulator, and I'm very frightened of that because I don't want to get paralyzed, and it may not work. And I feel a sense of concern that even pain doctors may not prescribe pain medication. Right now, I don't need pain medication. I'm comfortable. But I reached the point of when I'm at a point where I'm so uncomfortable and miserable. I don't know if I'm making sense.
You are making perfect sense, and I'll take this one.
Thank you.
So, first off, thank you so much for sharing. You did not sound nervous at all. And thank you for being vulnerable and telling us what's going on. Yes. So opioid medication is really difficult now to get prescribed, even through a pain doctor. I see a pain doctor right now, and I am prescribed opiates, but the goal is to have another medication that will control my pain so that I can reduce the opiates. But it's trial and error. So luckily, I have a really amazing pain doctor who is familiar with IC, so she gets it. I wish I could share her with everybody because she's just so great. So I would say, opioids aren't great for you long term. So trying to get you onto something different is a great plan, but it has to be a plan that works. So I would say be open to trying some other things. I've been not a lot of things today, so I'm also not a pharmacist. But there are things like buprenorphine, which is a medication that is safer, that a lot of pain doctors are utilizing now for chronic pain. So I would maybe ask about the buprenorphine. And it also comes in different dosages so that you can kind of tinker with the dosage to try to get to a point that it will actually help you. I also want to speak on the spinal cord stimulator, if I may.
Oh, I'm glad you are. Thank you.
I have one. So
Really?
yes. So I actually have an InterStim and I have a spinal cord stimulator. So you're saying right now they're recommending the spinal cord stimulator, right?
Well, it was a pain doctor. What I had a pain doctor tell me is he thought, well, I wouldn't go with it. I was leaning more towards, I was exploring it's not an InterStim. Right now, I'm forgetting the name of that other device that's being used now a lot. If you said it, I would know it. The name of it is.
Is it like a TENS unit or?
No, not a TENS. It's something that it's implanted surgically. It goes in a different part of the spine because, and that's not, there's no risk of paralysis with that one. I just, for some reason, the name of that device is just, I can't think of the name of it. If you said it, I would know, I would be able to say that's it. I was
Well, we are going to give you our email addresses. So if you think of it, let me know. But what I will say.
Oh, I'm sorry. There was one other thing I was going to say. Let's see. Now I'm forgetting. I'm sorry that it'll probably be coming back to me.
It's okay. You just jump in if it does.
Oh, thank you.
So the spinal cord stimulator, and there's a couple different brands of it. Medtronic makes one, Nevro makes one. I think there's another company. What that is meant to do is it helps with nerve pain. So, for example, I had a back injury that is not surgically treatable, and I had sciatica shooting down the backs of my legs. So what the spinal cord stimulator does is they implant electrical leads around T8 to 10 in your spine. So that's basically mid back. And those leads, they have electrical impulses run through them. Those impulses block the pain signals. So as my neurosurgeon put it, if we could all cut our heads off and live, we would not experience any pain, because the pain signals have to get to our brain to be translated into pain. So what this device does is it blocks those signals. Now, it doesn't block them entirely, but it blocks them so that they don't even get to your brain to be translated into pain. So what I will tell you with that and with the InterStim is they do a trial ahead of time. So you will find out before you go through like a big surgical procedure if it even works. And if it doesn't, they will not proceed. So they want to see at least 50% improvement of your pain in a 7-day period that they run that trial. So it's a great opportunity to try it. So I'm not familiar with something like that helping with IC pain. Again, I'm only an expert on my medical condition and what I use it for. But it's the same with InterStim. They always tell you don't get the InterStim to treat your pain. That may be a great side benefit, but it's not the main purpose of the device. So all that to say, there are risks with every medical procedure. Paralysis is a really scary one, though. I would say to dig a little deeper. We'll send you our email addresses, and if you think of the name of that, let me know.
I just looked it up while you were talking. It's Axonics.
Okay,
Axonics.
I'll look that up.
AXONICS. And I've had a couple of urogynecologists suggest that to me. And they said that they told me that it has been known to help IC. They've had patients get some relief. But a pain doctor told me that's more for incontinence or frequency. And I went online to different like online support groups where people were sharing their experiences, people with interstitial cystitis with different treatments. And some people liked Axonics. They felt it helped. Other people didn't get help by it. And I've had so many procedures that I really want to have a sense that there's a good chance it would help. I'm just exhausted. I was just so exhausted from trying this and trying that, and it's.
I totally get it. I just looked up that device. So this is actually one that I'm not as familiar with. Amber, have you heard of this one?
I'm surprised.
I know. It seems similar to the InterStim.
Right.
So, I would say it really depends on where you're at and your quality of life. You know what I mean? So
for me, it's really more, it's urgency and frequency. But what happens with me is that when my bladder senses urine in the bladder, it's very, very uncomfortable. It's where I have to just get that urine out.
Right.
I don't know. Is that a common experience with people with IC?
Yes. So a lot of patients can only the tiniest amount of urine in their bladder causes extreme discomfort.
Yes.
And so it's really that discomfort that is making them go to the bathroom so many times.
Exactly.
Yes.
And sometimes I worry, does the urologist really get it? If I was just like when I was younger, I've always had a history of frequent urination. It's certainly more frequent with the pain, but there wasn't pain with it. It wasn't, So I was able to have a good quality of life.
Mhm. I would say if you're having multiple providers are suggesting this, I would consider it, but it's your body.
Right.
The good thing is you can do that trial. And the other good thing is those devices are reversible. So if at any point it's not helping anymore, or there's just some other reason that you're like, I just don't want this, they can take it out even easier than they put it in.
Oh, well,
So
of course, if
that's what I'll say about that. You know, if you're at a point where you're just really struggling with your quality of life, then I think it's important for you to consider the options that your trusted care provider is giving you. If you feel like they don't get it, then it might be time to get that second or third opinion.
I've exhausted all the opinions. I've got to almost everyone. Of course, you can't reverse paralysis, so that I would be.
That is true.
Yeah.
That is true. That would concern me. I would probably try non-surgical interventions first.
That's why I'm much more comfortable with an opioid, because because
I get it.
yeah, I'm not going to get paralyzed with it.
Yeah,
And
you'd have to take a whole lot for that to happen.
if I can just pop in kind of real quick, as I've been listening. One thing that I would like to mention, Judy, I know you have a concern about when it comes to the opioids and other procedures going forward. And unfortunately, this is something that I have experienced recently. I have been put on kind of a long-term as needed opioid situation. And then I had fairly major surgery, and the opioids that they prescribed were the same ones that I had been on for the chronic IC. So before you proceed with any potential major surgery or anything that could possibly give you more pain than what you're currently experiencing, I would suggest that you have a very candid conversation with your provider. And that was something that I did not do that I regret now. Had I gone to them and said, hey, you know, obviously they know, okay, well, these are the opioids that you've been taking. But had I gone to them and said, hey, this is not going to help when it comes to something like post-surgical pain, when you're, basically cutting open my abdomen. There is a tolerance issue that we have.
Yeah, I know what you're saying,
Exactly.
but I
Exactly.
haven't, knock on wood, I haven't had to take an opioid since November.
And that's great. But however, you still have a tolerance within your system.
Oh, I do?
There are there are guidelines that they should be following, that you have taken this opioid for how long and the last time that you took it,
That's good to know.
before you proceed with anything further.
Oh, okay.
And then they can basically calculate what you would need to make you comfortable going forward.
Oh,
if that
okay.
makes sense. Okay.
Thank you very much for that information.
Absolutely.
Appreciate it.
Of course.
And Amber, I know that I believe you wanted to answer this next one. So, well, there was one other comment. It said, yes, always under anesthesia. So that was about procedures. That was a little bit earlier. Another comment was, I now use vaginal Valium and have medical marijuana card, which has helped. Stress is my #1 trigger.
Okay. I can absolutely relate to stress being the #1 trigger. For me as well, that's the #1 trigger. The one thing that we probably should talk about is the medical marijuana, which is extremely controversial. I don't know where you live. I don't know what the situation is in your state, because it's not at a federal level. If that is something that legally helps you, then that is something that you should talk to your provider or an actual medical marijuana provider about. The vaginal Valiums, I personally find extremely helpful. I get a lot of kind of pushback from the pharmacies because they don't understand that, hey, okay, we're filling diazepam or whatever it may be for vaginal insertion, which seems a little bit odd. Just kind of explain to them what's going on with that, and that absolutely what I typically do is I'll take that little Valium diazepam pill, maybe stick it under the faucet for like 2 seconds so that it gets that little coating off. And if you actually insert it vaginally, it will relax those pelvic floor muscles. So that's kind of the intention of what the doctors are doing when it comes to the vaginal Valiums. Sometimes they also will do like a vaginal suppository as well, which you can get from a compound pharmacy. And then it basically just does the same thing, just without having to put it under the faucet as a little pill. And then you can insert it that way and it will release those pelvic floor muscles.
Thank you so much, Amber. Well, thank you so much for being with us here today, Claudia and Amber. Today's session was so informative. We hope all of you enjoyed this webinar and learned something new. I know I did. If you found this event to be of value, please consider joining us for future webinars and share these opportunities with your community. Please mark your calendar for June 26th for our next webinar titled Clinical Trial Recruitment. Our speaker will be Dr. Rob Moldwin, ICA Medical Advisory Council member, and we will be sending out more information on that webinar. We also have an announcement. Did you know that the ICA is turning 40 this year? This is significant because the ICA has been the sole nonprofit organization dedicated to IC BPS for 4 decades. So please join us as we reflect on this significant year. And be sure to keep an eye on your inbox for ICA emails, follow us on social media, and participate in our 40th anniversary activities. Thank you so very much for joining us today.
Thank you.
Thank you
very much.
Have a good day, everyone.
Thank you. Thank you.